Hey everyone, thanks for joining me on another episode of Heathzone with Gilbert Cheah. I'm Gilbert Cheah, I'm the editor of Heathzone Singapore, a Facebook page that deals with health and wellness issues, specifically from a Singapore and regional perspective. So this week I wanted to talk about one of the most common ailments that affects us. It's something that almost everyone suffers from at some point, but for some people, the pain can be so bad and constant, it can be really debilitating. We are, of course, talking about back pains and aches. It's one of the leading causes of disability worldwide and can lead to even more serious conditions if left untreated. Now, back pain comes in many different forms with many different causes. The back is such a big part of our body and has so many different sections that involve muscles, tendons, ligaments, bones, joints, and each of these can have an issue that leads to back pain. And many people are unsure what to do about their back pain and usually rely on over-the-counter pain medications. And some endure the pain for years and even decades. Part of the problem is they don't really know what's causing the pain, so they just take painkillers. Let's look at the three most common causes of back pain and what you can do for each. Number one is a muscle or ligament strain. Now, this is the most common cause of back pain, a muscle or ligament strain that is caused when we lift something the wrong way or we make a sudden jerking movement that sprains the back. The back muscles and spinal ligaments can seize up as a result. And this can happen when you lift something heavy or when you pull hard on something that doesn't move. And yes, even if you sneeze violently and jerk your body. I've actually seen that happen before. And many of us have back muscles that are very tight and tense, and a sharp, sudden, and strong movement can cause these tight muscles to sprain, strain, and even tear. Now, one way to prevent such injuries, in addition to not lifting anything heavy, is to keep your back muscles supple and flexible, and you do this by regular movement and stretching. Tense, tight muscles will get strained and sprained much easier than relaxed, flexible ones. The treatment for muscle or ligament strain is mainly to let the strain heal and use therapies such as heat and ice, rest and compression. It's very important that you protect the strained area from any further injury, even small ones, as this can lead to even more serious back problems. Now, heat and cold therapies can be very effective at relieving pain and reducing swelling, but it's important to know which to use and when. This will depend on how long you've had your back pain. If your back pain is recent, say less than a 4-week duration, or if it's caused by a direct injury or sprain, then use cold therapy first. For example, you could use an ice pack. Lowering the body temperature on the injured area will help to constrict the blood vessels, reduce swelling, decrease inflammation, and help numb the pain. And once the inflammation has subsided, use heat therapy. Heat helps the tissues to be more relaxed, and this increases flexibility of muscles and also increases blood circulation, which helps injured tissues heal faster. Now, should you see a doctor, or when should you see a doctor? If you have a significant muscle injury where you cannot sit up or stand up, even after taking painkillers, do get yourself to a doctor. Also, if you hear a popping or cracking sound when you got injured, or if there is significant swelling, pain, fever, you should go to the A&E. Number 2 common cause of back pain and injury, a herniated disc or degenerative disc. These are two different conditions, but they are from the same body part, and that's the spinal disc. Because aside from the muscles, another area of the back that is prone to injury are our spinal disc. These discs are like cushions between the bones or the vertebrae of your spine, and they consist of a hard outer ring made of fibers, and it's filled with a gelatinous protein filling. Now, these discs act as padding to prevent the bones in the spine from touching each other. And if the fibers of the outside ring get damaged, this gelatinous protein can leak out and inflame the nerves that are in and around the disc and cause pain. Even if they don't leak, they can also bulge out and compress the nerves there. This type of condition is called a herniated disc. And herniated disc can be caused by strain or injury, but also these discs naturally degenerate as people age, and the ligaments that hold it in place get weaker. As a result, a strain or twisting movement can cause a disc to rupture. The other disc condition is called degenerative disc disease. This is usually an age-related condition when the spinal discs dry up and shrink as we get older. This shrinkage of the cushioning disc causes the bones to rub against nerves or against each other. And this narrows the space between the vertebrae and places stress on the bones and joints. And bone spurs can also develop as a result of this disc shrinkage and less space between the discs. Now, the symptoms of these two separate types of disc conditions are different. In a herniated disc, where the disc ruptures or the cushioning gel leaks or protrudes out, the person usually feels a sharp stabbing pain from the lower back down the backs of the legs. This pain condition is also known as sciatica, which is named after the sciatic nerve. This is a large nerve that runs from the lower back down the back of each leg. When something injures or puts pressure on the sciatic nerve, it can cause pain in the lower back that can spread to the hip, buttocks, and legs. If the herniated disc is higher up the spine, it can affect the shoulders and arms. And pain is not the only symptom of a herniated disc. Numbness, tingling, and muscle weakness are also common symptoms. The second type of disc injury is called a degenerative disc condition or degenerative disc disease. And this is a chronic, less intense kind of low back pain. It's more of an ache that intermittently flares up for a few days or weeks before returning to normal and then can reoccur again. Depending on the condition, the treatments for spinal disc pain vary, and these can be categorized with two main aims. One is physical therapy and stretching to help relieve pressure on the nerve, as well as chiropractic therapy to help realign parts of your musculoskeletal system. The other course of pain relief treatments are to address the symptoms. These include using ice and heat therapy for pain relief, using non-steroidal anti-inflammatory medications or NSAIDs, which are such as ibuprofen or naproxen, for pain relief and to reduce inflammation, or steroids, which can also decrease inflammation for pain relief. And there's also epidural injections. Now, experts say a process of trial and error is often necessary to find the right combination of treatments. You can try several at a time, such as undergoing pain treatment while also undergoing physical or chiropractic therapy. If after 6 weeks or so of these therapies you're still having pain, you have the option of considering lumbar decompression surgery. The most common is called microdiscectomy, where a part of the disc that is putting pressure on the nerve is removed. This gives the nerve more space and relieves the pressure on it, thereby allowing it to heal. Now, although surgery sounds scary, the good thing about a microdiscectomy is that it's a minimally invasive procedure that takes about an hour. Another type of surgery to relieve pain of disc problems is spinal fusion. This is a surgical procedure to join two or more bones of the spine together permanently. This is done to prevent the vertebrae from rubbing against each other because this causes pain for those with osteoarthritis. Spinal fusion may stop this pain by preventing one or more of your vertebrae from moving. In addition to the traditional spinal fusion surgery, there's also a newer, minimally invasive type of spinal fusion that uses a smaller incision than the traditional surgery. Of course, it's best to start with a more conservative approach first before going for surgery, but this will be best determined by your doctor. Now, the third frequent cause of back pain is osteoarthritis, which is the most common type of arthritis. This causes a breakdown of the cushioning and connecting cartilage of the joints and disc in the neck and lower back. Osteoarthritis in the spine can cause many painful conditions. It can lead to a narrowing of the space around the spinal cord, which puts pressure on the nerves that travel through the spine. Wear and tear damage from osteoarthritis on your spinal bones can also cause the formation of bone spurs in the spinal canal. Another condition is when the ligaments that help hold the bones of your spine together become stiff and thicken over time and bulge into the spinal canal, again causing pain. Now, because the pain from mechanical damage, or rather the pain is from mechanical damage, such as when you bend or twist your back, it will get worse if you have these kinds of movements. Also, if you had a previous back injury, you are more likely to develop degenerative arthritis of the spine. Osteoarthritis occurs most often in the lower back and also the neck. So there are many different manifestations of osteoarthritis when it affects the spine. The treatments for this are not that different from those for disc problems, and these include pain relievers, physical therapy, steroid injections, and surgery. Now, that's this week's show, but we're not yet done with this important subject of back pain. Next week, I will share with you the causes of back pain, some of which may surprise you, and how you can prevent back injuries and pain and protect yourself. So be sure to tune in next week for the second part of this very important episode about back pain. And thanks for joining us this week. Stay safe and stay healthy. Thank you.